It is 10:30 on a Tuesday night. Your kid has a fever of 102. Or your back went out and you can barely stand. Or you sliced your hand cooking dinner and it won't stop bleeding. You don't know if it's serious, you don't want to overreact. But your doctor's office is closed and the only thing you know for certain is that you need someone to look at this tonight. So you do what most Americans do. You drive to the nearest place that looks like it can help. And that decision, made in the dark, in pain, without any information about what it's going to cost, will determine whether you get a bill for $150 or $3,000 for the exact same treatment. This video exists so that the next time you are standing in that parking lot, you know exactly where you're going and why. Americans spend $4.4 billion every year on unnecessary emergency room visits, care that could have been handled at an urgent care clinic for a fraction of the cost. Up to 60% of all emergency department visits are non-urgent and potentially avoidable. That is not a fringe problem. That is the majority of people walking through ER doors on any given night. And the cost difference between making the right call and the wrong call is not marginal. The average cost of treating common, primary care treatable conditions at a hospital emergency department is $2,032, 12 times higher than visiting a physician's office and 10 times higher than an urgent care center for the exact same issue. 10 times for the same sore throat, the same sprained ankle, the same ear infection. Before we get into exactly which conditions go where, you need to understand why the cost gap is so enormous, because once you understand the structure, the numbers stop being shocking and start being predictable. An emergency room is a 24-hour operation staffed by emergency physicians, trauma surgeons, anesthesiologists, radiologists, cardiologists, and a full nursing team, all standing by regardless of whether the patient who walks in needs all of them or none of them. The moment you walk through an ER door, the facility begins billing you for access to that entire infrastructure. That charge is called the facility fee, and it exists before a single doctor has examined you, before a single test has been ordered, before anyone knows what is wrong. ER facility fees alone, just the charge for walking in the door and being evaluated, range from $200 to $4,000 depending on the severity level your visit is assigned. And emergency rooms assign severity levels the same way we discussed in our hospital billing video, on a 1 through 5 scale, with level 5 being the most expensive and most frequently upcoded. If you come in for a minor infection and receive 3 diagnostic tests while you wait, you may be coded at level 5. $2,000 in facility fees before the doctor has prescribed a single antibiotic. An urgent care center does not carry that overhead. It is staffed by physicians and nurse practitioners trained in exactly the conditions that make up the majority of after-hours medical visits. It does not have a trauma bay. It does not have an ICU. It is not on call for ambulances. And because it is not carrying the financial weight of all of that infrastructure, it does not charge you for it. The average urgent care visit in 2026 costs between $150 and $280 without insurance. With insurance, most people pay a copay of $20 to $75. That is the entire bill, not the facility fee alone, the entire visit. Now let's talk about the conditions, specifically which ones belong in an urgent care clinic and which ones genuinely require an emergency room, because this is the decision that determines everything. Go to an urgent care clinic for a fever in an adult or child that is not accompanied by stiff neck, severe headache, or difficulty breathing, a sore throat, even a severe one, an ear infection, a sinus infection, a urinary tract infection, pink eye, a minor cut that needs stitches. Urgent care clinics can suture wounds, a sprain or strain, a minor broken bone like a finger or toe, a mild asthma attack in a patient with a known diagnosis and rescue inhaler, nausea, vomiting, or diarrhea without signs of severe dehydration, a rash without difficulty breathing, a mild allergic reaction without throat swelling or breathing problems, flu symptoms, a cold that has gotten worse, a minor burn, an animal bite that needs cleaning and assessment, a mild headache, back pain without neurological symptoms like numbness or weakness in the legs. Go to an emergency room for chest pain or pressure, always without exception, even if you think it might be nothing. Difficulty breathing or shortness of breath that is new or worsening, Stroke symptoms: sudden facial drooping, arm weakness, speech difficulty, sudden severe headache described as the worst of your life. A severe allergic reaction with throat swelling, hives spreading rapidly, or difficulty breathing. Uncontrolled bleeding that will not stop with direct pressure after 10 minutes. A high fever in an infant under 3 months old. Seizures. Loss of consciousness or altered mental status. A major injury, car accident, significant fall, suspected spinal injury. Sudden severe abdominal pain, signs of appendicitis, pain that starts around the navel and moves to the lower right, worsening over hours. Severe head injury with loss of consciousness, confusion or vomiting, poisoning or overdose. Psychiatric emergencies, active suicidal ideation with a plan or intent. The line between those two lists is not always obvious, and the consequences of drawing it wrong in either direction are real. Missing a genuine emergency is dangerous. Going to the ER when you didn't need to is expensive. The framework is this: if the condition could kill or permanently harm you in the next few hours without intervention, that is an ER condition. If it is painful, uncomfortable, or getting worse but does not carry that immediate risk, that is almost certainly an urgent care condition. Now we need to talk about the most dangerous billing trap in American healthcare that most people have never heard of. It is called the freestanding emergency room, and it may be the single most important thing in this video. A freestanding ER looks exactly like an urgent care clinic. It is in a strip mall or a standalone building. It has a parking lot and a waiting room and a reception desk. It has a sign out front. That sign might say emergency care, or emergency center, or ER, or emergency room. What it does not say, anywhere visible from the outside, is that you are about to be billed at full hospital emergency room rates, not urgent care rates. You walk in expecting a $200 visit. You leave having received a $3,000 bill. Freestanding emergency departments often cost 50% more than hospital-based emergency rooms. Let that register. Not 50% more than urgent care, 50% more than a full hospital ER. And many freestanding ERs are not in network with any insurance plan. Because they often don't contract with insurers, freestanding ERs charge much higher rates than in-network hospital ERs, and they bill patients for the portion that their insurance company declines to pay, a practice known as balance billing. Texas is the epicenter of this problem. After Texas passed a law in 2009 allowing the licensing of freestanding emergency care facilities, the number of such facilities grew from 40 to nearly 250, with about 36 new ones opening in a single year. They are concentrated in suburban areas with high rates of private insurance, because that is where the billing is most profitable. They look like urgent care. They bill like hospitals, and the distinction between the two is invisible from the sidewalk. Before you walk into any facility that is not clearly labeled as an urgent care clinic, ask one question directly to the person at the reception desk. Is this facility billed as an emergency room or as urgent care? You have a right to that answer before you check in. If the answer is emergency room, even if the building looks nothing like a hospital, you will be billed at emergency room rates. Make that decision with open eyes. There is also a third option that millions of Americans underuse, especially for conditions that feel urgent but are not dangerous. Telehealth. Telehealth urgent care has evolved significantly, with virtual visits costing $40 to $100, often the cheapest option for minor issues. For conditions like UTIs, sinus infections, pink eye, rashes, mild ear pain, and prescription refills for known conditions. A telehealth visit at 11 at night costs less than your copay at an urgent care clinic and produces the same outcome. A diagnosis and a prescription sent to your pharmacy. Major telehealth platforms like Teladoc, MD Live, and Amazon Clinic are available 24/7. Your insurance plan may already include telehealth visits at no cost. Check your benefits before you need them. Now let's build the practical system. Because having this information when you are sick and scared at 10:30 at night is completely different from having it right now, calm and prepared. Step 1. Find your nearest urgent care clinic today, not the night you need it. Search urgent care near your home address, Verify it is in network with your insurance. Note the hours and save the address in your phone under a contact called Urgent Care. Do this for urgent care near your workplace as well. The most common reason people go to ERs for non-emergency conditions is simply that they don't know where else to go in the moment. Remove that variable now. Step 2. Look up whether any of the facilities near you are freestanding ERs. Search the address plus the words freestanding ER or emergency department. If a facility near you looks like urgent care but is actually a freestanding ER, know that before you are standing in their parking lot in pain. Step 3. Check whether your insurance plan includes telehealth coverage. Log into your insurer's app or website right now and find the telehealth section. If coverage exists, download the app and set up your account. This takes 10 minutes. It may save you $2,000 the next time someone in your household gets sick on a Saturday night. Step 4. Know the specific symptoms that override all of this. Chest pain, difficulty breathing, stroke symptoms, uncontrolled bleeding, seizures, severe head injury, loss of consciousness. These are ER conditions regardless of what anything costs, regardless of what time it is, regardless of whether it might be nothing. The financial framework in this video does not apply when the condition is potentially life-threatening. Call 911 or go directly to the nearest hospital emergency room and sort out the bill later. Step 5. If you end up in the ER for something that turned out to be non-urgent, request your itemized bill with CPT codes, exactly as we discussed in our hospital billing video, and look for the evaluation and management level you were assigned. If you were coded at level 4 or 5 for a condition that was minor, dispute it. The coding is frequently wrong and frequently inflated, and disputing a level downward can reduce your bill by hundreds of dollars. Here is the thing that ties all of this together. The emergency room is a miracle of modern medicine. It exists for the moments when nothing else will do, when someone needs a trauma surgeon at 2 in the morning, or a cardiologist in the next 20 minutes, or a crash cart in the next 60 seconds. It is an extraordinary resource. It is also one of the most expensive places on earth to treat a sinus infection. The system does not tell you which one you need. It accepts everyone, treats everyone, and bills everyone at the same rate, regardless of whether your condition required any of the infrastructure you just paid for. That information gap costs American families billions of dollars every year, paid in ER bills for ear infections and sprained ankles and UTIs that an urgent care clinic would have handled in 45 minutes for the cost of a dinner out. Now you have the information. Use it before you need it, because the moment you are in pain and panicked in that parking lot is not the moment to be figuring this out for the first time.